How to get pregnant. For some people, avoiding pregnancy is difficult. For others, however, conceiving a child can be elusive and frustrating. With so many fertility potions and products on the market promising fantastic results, it can be hard to figure out which is right for you. Several factors can affect fertility, but there are some things you can do to up your chances of a big fat positive. The basics of getting pregnant. Stop using contraceptives. Some birth control methods have a longer readjustment period than others, so be aware that you might not conceive right away. The time it takes for a woman's body to be again ready to become pregnant after discontinuing contraception varies. Hormonal contraceptives, such as oral birth control, hormone injections, or the NuvaRing, might have a longer lag period while your body readjusts. If you have an implanted contraceptive, such as a NID, you need to see a health professional to have it removed. If you are relying on barrier methods, such as condoms, cervical caps, diaphragms or sponges, you don't need to worry about a readjustment period. This doesn't mean you'll conceive immediately, though. Also, take caution to prevent sexually transmitted infections if you are relying on these devices for protection. Figure out when you're fertile. If you can time it right, your odds of becoming pregnant will be much higher. There are a few tricks to tracking your ovulation. Count forward from the first day of your last period. On average, most women ovulate 14 days after they first begin to menstruate. Does this mean you should only start trying 2 weeks after your period? Not exactly. See Step 3 for more help. If you have regular cycles, you can often estimate the time of ovulation by dividing your cycle in half. For example, if your period usually lasts 28 days, you will likely ovulate around day 14 of your cycle, 14 days after you begin menstruating. If you have a longer cycle, you may ovulate as late as 20 days after your period began. 1. Download a tracking app. If you find it difficult to keep a calendar of your cycle, make an app do it for you. Search ovulation tracker and find one that works for you. Take your basal body temperature. Your body's temperature will rise slightly when you're ovulating, so an uptick is a good sign that you're fertile. 2. Keep a thermometer by your bed, and take your temperature first thing in the morning when you wake up. Try to do it around the same time, jot down your temperature each day. If you notice a spike between 0.5 and 1 degree Fahrenheit that lasts more than a day, you might be ovulating. 1. Fertility is highest during the 2 to 3 days before your basal temperature rises. 1. So if you can observe any month-to-month patterns in when your temperature rises, you can predict the best time to conceive. Keep track of your cervical mucus. It sounds gross, but it works. When your vaginal discharge is clear and stretchy, like raw egg whites, you are most likely fertile and should plan on having sex daily for 3 to 5 days from the day you noticed this consistency in your discharge. Once the discharge becomes cloudy and drier, you are less likely to conceive. Use an ovulation predictor kit. Just like buying a pregnancy test, you can pick up an ovulation predictor kit from your local drugstore. The cost can add up, though, so this might be a good way to jumpstart calendar charting by figuring out when you tend to ovulate. Have sex. Once you know you're fertile, get busy. When and how often you have sex can influence how quickly you conceive, so try these tips. Start having regular sex slightly before ovulation. Here's the thing, an egg is viable for about 24 hours, but sperm can survive for up to a week in the fallopian tubes. To make sure you don't miss your shot, start trying to conceive a few days before you think you might ovulate. Keep the sperm supply fresh. However, just because sperm can last up to a week doesn't mean they're in tip-top shape by then. To combat this, aim to have sex at least every other day while you're fertile. Though you can certainly try more often, too. Do not use spermicides, lubricants, or chemical stimuli. Products aimed at enhancing pleasure or preventing conception should be avoided during intercourse if you are trying to achieve pregnancy. 3. Enjoy yourself. Orgasming after your partner ejaculates into you can help pull sperm into the cervix, which may facilitate the movement of your partner's sperm. Bask in the afterglow. Don't make the sperm work against gravity. Instead of getting up immediately afterward, lie back and relax for a few minutes. Studies on the efficacy of artificial insemination demonstrated that lying flat for 15 minutes after sex can increase your odds of conception up to 50%. 4. Test for pregnancy. Once the ovulatory period has passed, the waiting game begins. Wait until your next expected period. If it doesn't show up, take a pregnancy test and see what happens. If you're the impatient sort, you can try these methods a little earlier. Keep taking your basal body temperature. If your temperature stays high for 14 consecutive days after ovulation, odds are good that you conceived. Watch out for implantation symptoms. Some women experience end implantation bleeding, which usually turns up as slight spotting as the zygote attaches to the uterine wall. It usually happens 6 to 12 days after conception. You might also experience slight cramping. Tips. If you are postmenopausal, you have stopped menstruating completely, or if you have had a surgery that removed your ovaries or tied your fallopian tubes, you will be unable to get pregnant. Don't give stress to your partner if nothing seems to be working. Sometimes it just takes time. A man can wear briefs without decreasing sperm count. However, hot baths, whirlpools, tight athletic clothing, extensive bicycling, and extended placement of a laptop in the pelvic region may reduce a man's sperm count. 28. Obesity in either partner can decrease the chances of conception. By first achieving a healthy weight, you may conceive more easily and have a healthier pregnancy. 29-30. Warnings. Trying too hard to get pregnant, especially by strictly following a schedule, can cause stress and reduce physical and emotional intimacy between you and your partner. Becoming parents is a big decision which should not be taken lightly. Make sure you and your partner are mentally ready to have a baby. Make sure that you and your partner are disease and infection-free before stopping any barrier methods of birth control. Make sure you're ready to have a baby. Talk to your parents and your